An overview of Clarence, our people and their health. Here are some things that we're learning. The Clarence City local government area has a broad and diverse population. The population is diverse socially, economically and geographically. Some people find it hard to use, access or find services or supports that would help them be healthy. This includes things like GPs, housing and social supports, specialist medical services and physical activities. The health and wealth of individuals, families and whole communities is not equally experienced across Clarence. Statistical data for the whole of Clarence doesn't show these differences. It is much more helpful to look at statistics for each suburb individually. People across Clarence are involved in a lot of different activities, including social, sporting and community-based activities. Many groups are run by both volunteers and workers. Some organisations in Clarence who run a number of community programs include Clarence Plains Child and Family Centre, Rosny Library, Neighbourhood Centres, Clarence Integrated Care Centre, Clarence City Council and non-government organisations. Some of these groups include physical activities, social and craft activities, mental health support, information sharing programs, One Community Together, parenting support and faith-based activities and programs. Lots of people who live in Clarence rate their health as excellent or good. Statistics show that overall fewer people in Clarence smoke, exercise too little and drink too much. But the statistics also show that overall there are more people in Clarence at risk of being overweight or obese, having 3 or more long-term health conditions, and doing too little muscle strengthening activity. Clarence has a higher rate of people going to hospital for things that could have been prevented, including heart disease, lung disease and diabetes complications. Risks are higher for some residents of Clarence. Here's what we think is happening. People who are involved in groups, activities and programs that improve their well-being and health are easier to engage with. It is often difficult to engage with people who are less engaged in these activities and might be at higher risk of developing long-term illnesses. We'd like to learn more. We have lots of information about people who are accessing health and community services, but we don't have much information about people who are not accessing services. We want to know why people don't access services. What can be done to improve their health and well-being? And how do we find new ways to engage with these people? We really want to know, what do the people of Clarence think about health? Is it a hot topic for this community? There are many free or low-cost things happening in the Clarence community, and whilst some people are attending and engaging with these things, many people are not. We want to know why this might be. And is it more the case for particular areas or groups within Clarence? What do you think?